hospitals.
And Tampa's Mayor Jane Castor says we are in the middle of a crisis, especially with this Delta variant spreading like wildfire. Hillsborough's positivity rate is 23%. That's absurd. That's 5 times where we're supposed to be. The only way to stay out of the hospital, Mayor Castor says, is by getting your COVID shot.
What the medical personnel that are behind me, what they will tell you today is that with this Delta variant, that if you have not been vaccinated, then you have around 100% chance of contracting COVID-19. Please do your part for yourself personally, but for your family, your friends, and your community. It's imperative.
And you saw this young man standing behind Mayor Castor there. She was joined by healthcare providers and COVID survivors. This is Nick Hansen, tested positive in December, but he's only recently started to get back to normal. He's one of many of what we call these COVID long haulers, those still feeling symptoms long after recovering from this virus. And it's something that doctors tell 10 Tampa Bay's Angelina Salcido they've learned to treat.
I could only equate what I went through as a hell on earth.
Nick Hansen's battle with COVID-19 has been overwhelming and unexpected.
Debilitating headaches, fatigue, memory loss. I was unable to get out of bed most days.
He's a long hauler, and it's taken 9 months to heal.
It really has been challenging, really trying to figure out what we can do and really the kind of resources they might need to try and restore their quality of life.
USF Health's Dr. Kevin Sneed continues to treat COVID-19 long haulers like Nick. He says most of his patients are young, healthy, and had mild cases.
We're talking about people that had very mild conditions from COVID-19 that recovered fairly quickly and thought they were going to move on with life, and it just hasn't turned out to be that way.
There's definitely an impact.
Dr. Alba Azola's patients in Johns Hopkins' post-acute COVID-19 clinic are the same.
They are impacted in their day-to-day lives because of this lingering symptoms.
Over the last 16 months, doctors learned there isn't one set treatment to help.
There has been at times trial and error to try to figure out what medication or what treatment is going to be most efficient.
But it's become easier to guide patients through their recovery.
I've seen the effect of what can happen with the current surge that we're experiencing across the country, and especially with Delta. We may have a rash of COVID-19 long haulers beginning in October and extending into the remainder of the calendar year.